while I wait for the slides. Thank you, Dan and Rotary, for organizing this conference. And it's really exciting to be part of this community. And thank you for inviting me for this talk. So we are now in a very pivotal moment for global health and for the fight against malaria. On one hand, we have the cases rising annually, far from the targets, as the first speakers they mentioned, maybe tenfold off from the targets set for malaria elimination. And yeah, our recent funding cuts jeopardize progress that was made for decades. And then we have gene deletions that render most of our widely used RDTs ineffective. On the bright side, though, we have made significant advancements in technologies like machine learning, AI, robotics, and computing, which lets us reimagine the way we diagnose malaria. CEFLA aims to harness this convergence of technologies to create an automated microscopy platform to detect malaria and other diseases. So looking at the diagnostic landscape, we have RDTs. They're very simple to use, cost-effective, but are prone to gene deletions, so the false negatives due to gene deletions. They're not quantitative, so cannot be used for treatment or vaccine efficacy monitoring, and their detection limit doesn't allow for low parasitemia or asymptomatic case detection. On the other hand, we have microscopy, which as a visual identification, it can be used to identify species, it can be used to quantify the parasites, but it's very error-prone, requires extensive training, and has variable sensitivity based on the training, and even for the same trained person based on the workload. And the most sensitive technique, the PCR, as we all know, is expensive, is very resource intensive, and not very portable and field friendly. So there is a need for scalable, quantitative, and accurate diagnostic tools for detecting malaria, and especially for our fight towards the elimination of malaria. So we built Octopi, which is an automated microscopy platform. It's a robotic microscope which also uses AI to detect malaria parasites. Intentionally, we use a standard glass slide interface, and we use a thin smear to look at blood cells. We use fluorescence microscopy, so these are fluorescently tagged parasites, so we can actually image much larger fields of view and go much faster, orders of magnitude faster than a human can. Here is a demo of how the instrument and the user interface works. It's a simple user interface with a few buttons to click. You go to the slide loading position. You can see the slide holder moving. The operator puts the slide, and with a click of a button, the machine automatically scans and processes the slide. Now, you can see here, this is now all happening in real time, by the way. There is an autofocus calibration routine that determines the focus for the best focus points for the slide. And then we capture 3 sets of images, 2 bright field and 1 fluorescence. You can see the flashing light on the machine, but we're capturing, each field of view has roughly 5 to 10,000 red blood cells, and then you see the real-time detection of the parasite. So this is machine learning-based segmentation, so we're actually identifying the red blood cells, counting them, and then detecting the parasites, and then classifying that, whether or not it is a parasite. Now this happens orders of magnitude faster than a human ever can. So we're detecting processing at the speed of like almost, almost around 1 million cells per minute. And then here we have, let's say, a report where you get all the parasites that were detected, and the expert microscopist can review it, and you can see that these are all ring-stage falciparum parasites. Another key innovation is the smear making. We know that smear quality is a huge issue. So we use this 3D printed device that uses a syringe. It's a very low-cost device, but it consistently creates thin smears, and even better than the feathered edge that we normally get. Here, actually, we get a monolayer that is consistent throughout the slide. This, like I said, allows for unprecedented amount of data. This is, for instance, one slide. You can zoom into the slide, and then you can see the cells now here and the parasites. And this is just one section of the slide. So the amount of data that we're getting from one single slide is unprecedented. We have 10 to 20 million red blood cells that we can analyze on a thin smear, which lets us use microscopy even for low parasitemia and possibly asymptomatic cases. So in terms of results, we have some promising results from a recent clinical study we conducted in Uganda and USA, mostly to detect falciparum. The patient-level sensitivity and specificity was over 97%, which is very promising. And another promising result is that the limit of detection is in the order of 12 to 15 parasites per microliter. That's the estimated limit of detection. And we can do this at extremely high throughput. So we're doing 500,000 to 1 million red blood cells per minute. Now, this is work that's been going on, first started almost a decade now. It started at a lab in Stanford University, and we've been collaborating with clinical partners around the world, primarily in Africa, to validate, test, get user feedback, and that's been a very critical part of our development. Now, the development is being done at CEFLA, which is a spin-off from Stanford University, and we're actively still expanding our clinical collaborations, and actually right after this trip, I'll be going to Liberia and Tanzania to do some more field studies, collecting data, feedback, and so on. The framework of Octopi is we have a modular design that lets us detect not just malaria, but other diseases as well. And we have high throughput data, which is very essential for machine learning algorithms. So we can improve the deep learning or machine learning models, and deploy it globally, and then repeat this cycle to make the algorithms more robust, and even expand it to other diseases, other species of malaria. So our big vision is that we have one platform where we can do multiple disease diagnostics. So we like to think of it like an app store, but for diagnostics. So we're focusing our efforts on malaria, but we and our collaborators have also explored other diseases like sickle cell disease, which actually coexist with malaria. So there is great benefit at looking at detecting sickle cell disease in areas where malaria is prevalent. And our collaborators have been working on tuberculosis, bacterial vaginosis, to name a few. And like I said, this work is not possible without the community that we've built of clinical collaborators, and the work done at CEFLA, Prakash Lab at Stanford, and all the amazing partners that we have. I will end with some stories from the field. So last year we went to Senegal and did 7 different field visits, and we kept hearing, this was mainly to get some feedback and then get more data for improving our models, but we kept hearing this from expert microscopists, mostly like senior expert microscopists, that they see the device, they get excited, and they say, you're many years too late. My eyes are now ruined by looking at the microscope for so long, right? So people are willing to use these tools, and they are excited about this technology. And out of the 7 sites, we got overwhelmingly positive feedback, and everyone was interested in keeping the device, but we weren't ready to do that yet. I think we're in this stage where we're testing the robustness of the device, we're expanding the clinical collaborations, we're expanding our team, we're expanding into other diseases, and I think we're just getting started. But I think we're at the cusp of where this technology can be useful and be deployable to make big impacts, not just in malaria, but in other diseases as well. Yeah, thank you so much for your attention.